What would happen if you struck matches all day, every day, for 20 years straight? It sounds like a weird hypothetical, but this was the actual reality for thousands of workers in the 19th and early 20th centuries. Match factory workers, mostly women and children, would spend 14-hour shifts in crammed, poorly ventilated factories dipping wooden sticks into white phosphorus solutions and striking them to test quality. They did not know they were signing up for one of the most horrifying occupational hazards in industrial history. The unfortunate answer to this question involves a condition so gruesome that it earned the nickname Phossy jaw. And trust me, you do not want to Google image search that during lunch. Let us start with the repetitive strain injuries. Because even before the chemical horrors kick in, your body would start falling apart from the sheer monotony of the motion itself. Striking a match involves a quick, forceful flick of the wrist combined with finger grip strength. Doing this thousands of times per day would lead to classic repetitive strain injuries like carpal tunnel syndrome, tendinitis in the wrist and fingers, and possibly even trigger finger, where your digits literally get stuck in a bent position. Studies show that repetitive hand motions can cause microtrauma to tendon, muscles, and nerves, leading to chronic pain, numbness, tingling sensations, and reduced grip strength. After 20 years of this, your hands would likely be a mess of scar tissue, with permanently reduced mobility and constant aching pain that gets worse with any kind of hand activity. But here is where things get truly nightmarish. White phosphorus, the chemical used in those old-fashioned strituniwerma, is horrifically toxic when you breathe its fumes or absorb it through your skin. Workers were exposed to phosphorus vapors constantly, and within just 5 years of exposure, many began developing phosphorus necrosis of the jaw, better known as Phossy jaw. The condition started innocently enough with toothaches and what felt like flu symptoms, but then your jawbone would literally begin to rot from the inside out. The phosphorus would cause the bone tissue to die and become necrotic, leading to abscesses, severe facial deformities, and a glow-in-the-dark discharge from the wounds because, yes, white phosphorus is bioluminescent. Patients often had to have large portions of their jaws surgically removed, and the infection was frequently fatal. By 1890, an estimated 20% of match workers who developed Phossy jaw died from it. Beyond the jaw, chronic phosphorus exposure wreaks havoc on your entire body. Research shows that phosphorus toxicity can cause severe damage to your liver, kidneys, cardiovascular system, and bones. Your liver would become enlarged and tender as it struggled to process the toxin, potentially leading to liver failure. Your bones would become brittle because phosphorus disrupts the calcium phosphate balance in your skeletal system, making fractures far more likely from even minor trauma. Some workers in historical accounts broke their femurs from simply tripping over a board or stumbling down a single step because their bone composition had been altered so dramatically. You would also experience gastrointestinal distress, severe anemia, general physical wasting, and chronic bronchitis from constantly inhaling irritating fumes. The psychological toll would be equally devastating. Imagine watching your coworkers slowly deteriorate, their faces literally falling apart, knowing that you are on the same path. Historical accounts from match factory workers describe an atmosphere of fear and resignation, where young women and girls worked in what was called standing for 14 hours straight with only 2 breaks, unable to even use the restroom without being fined. The stress of working in dangerous conditions, combined with chronic pain and the visible evidence of your body failing, would likely lead to severe anxiety, depression, and a profound sense of hopelessness about your future. So what would happen if you struck matches all day for 20 years? You would end up with crippled, painful hands from repetitive strain injuries, a disfigured or missing jaw from phosphorus necrosis, brittle bones prone to fractures, damaged internal organs struggling to function, chronic respiratory problems, and severe psychological trauma. This is not a hypothetical horror story. It is exactly what happened to thousands of real people, mostly impoverished women and children who had no choice but to accept these conditions to survive. The 1888 London match girl strike finally brought attention to these abuses, but white phosphorus was not banned in Britain until 1908, decades after the dangers were well known. Sometimes, the most horrifying experiments are the ones we have already run on human beings in the name of profit.